Hi everyone, it's Elle. Okay, so I've been getting a lot of questions about what my day looks like when working with moms. So I'm building a program, so half my day is usually devoted to that, and then the other half is devoted to working with moms. But I have had days where all I did was work with moms, and I've done like 10-hour day, an 8-hour day, 12-hour day to kind of see what worked best. And what I found was that if I want to see all of the moms on the floor, I should do a 12-hour shift. That's how I see every mom. If I don't do 12-hour shifts, then I'm not really able to get all of the moms that come in and rotate through. Because the maternity unit is really fast. I mean, moms are coming into postpartum, they're there for a day, maybe two, and they're gone. And so when you come in on Monday, if you haven't been there over the weekend, you're backlogged. And it's just over the night. If nobody's covering overnight, obviously no one is, and then there's backlog. So 12-hour days are what I have found to be most effective in order to see all moms with just one therapist. And really, with that, I mean, there's going to be moms who fall through the cracks because I don't have weekend coverage, I don't have night coverage, and I can get to those moms in the morning, but not within those 6 hours, those vital 6 hours to help prevent PPPTSD. So 12-hour shifts seem to be pretty good for a hospital known for maternity care. Other hospitals that maybe aren't as heavy on births, they don't have as many moms that like to come in. It's not as trendy for moms. They don't have as many options. Maybe you don't have as many births. Maybe you're more rural or you're in a smaller city. The area I'm in, population of like 2.5 million. So not a ginormous city, but also not a small city. It's a good size. Again, one therapist, one busy unit. So if I were to staff a program like this, or just OTs on the maternity unit, it would look like at least 2 to 3 OTs, and that would be minimum, and that would be 12-hour shifts. Um, 3 12s. So maybe even four therapists to make sure that there's somebody, who can cover other people's days off, etc. And really that's, so you have 3 12s. So if you have four people and 3 12s, that's what, so 24 times three, right? Like 72 hours. Okay. And so if we're looking at a normal work week, be 40 hours throughout the week if you're doing a normal schedule. But if you're trying to see moms, it overlaps and gives you coverage. The hardest thing, the most frustrating thing for me is not being able to get to those moms who do have traumatic births, but they're late at night or early in the morning and not within those 6 hours where I can help them. I have been offering them other resources. For example, there are other researched methods to help prevent PPPTSD, such as journaling about the birth experience, yoga, once the doctor releases them to exercise, meditation. As far as stress relief, breathing, there are breathing patterns that have been shown to help with stress. And you can even bring in the blood pressure cuff, take their blood pressure before the breathing, do the breathing, and then show them again their blood pressure. And then there's that biofeedback to where parents then are sold, right? Before they're like, oh man, I'm just breathing and it's silly. It's just woo woo, not doing anything. But when they can see, there is a real change, then they're a lot more likely to adopt that behavior. So there are things I'm offering moms. I also offer moms ergonomics training, transition planning, safe infant handling, just a few different things in order to make sure that all moms that are participating are getting something out of it, some benefit, because I feel that is the ethical way to approach this. So I think there are a lot of things that OTs can do in the maternity unit. I feel like really ideally you could fully staff OTs like in the other units in the ICU, and it would be successful and wonderful and great. And I've gotten really positive feedback from moms. And I've had moms tell me, for example, when I talk to them about skin to skin, because I ask them after I do their 4 questions to assess if they had a traumatic birth, I then ask, did you get skin to skin immediately after birth? And then for how long? because we know that skin to skin contact for 1 to 2 hours after giving birth protects the mom from developing postpartum PTSD. And I had one mom in particular who said to me that with her first birth a few years ago, that she did not get that skin to skin contact, and she felt stressed and she felt worried and all of these things, and it turned into postpartum depression. And she believes she probably did have postpartum PTSD. So with this time, her primary care provider in obstetrics care was a nurse midwife who was a lot more holistically focused and who really made sure that mama got that skin to skin contact right away, and it was maintained for a couple of hours. And she said, I can already tell the difference. She said, Elle, so with the last one, I felt anxious. I felt just like everything was scary. And she said this time around, she actually had some complications, and she didn't have complications with the first pregnancy, but she did with this one. And she said that with this pregnancy, despite the complications, having that baby skin to skin just made her feel calm. She wasn't worried. She felt like everything was right. All of those frightening memories just kind of, melted away. And so, of course, that's anecdotal. But to me, that's powerful. That just goes to show that even if it is anecdotal, even if it's a placebo effect, even if any of those things, we know that the power of the brain, of mental health, psychology, influences what your body experiences. So for me, that's really great feedback. But going back to my schedule, I usually do come in at 7 in the morning. I wish that I could come in at 6 in the morning, but it doesn't work with my schedule with my children. So 7 in the morning is when I come in. Ideally, it would be 6 in the morning so you could catch night shift for nursing staff and kind of talk to them and find the moms that had babies overnight. And just anecdotally, from my experience, it seems like a lot of moms have babies from like 5, 6 p.m. until like 2 in the morning. And there's occasionally a mom, if they've had a baby closer to 2 or 3, that I can get to when I first come in the morning. But often I can't. I'm just like an hour too late. And that's why I wish I could come in at 6. And then I noticed that there's a couple moms that give birth in the morning. And then right before I leave, I usually leave somewhere between like 3:30 and 5:30, although I have stayed as late as like 6, 7 p.m. at night. And I've noticed that these moms start giving birth right when I'm about to leave. And I am in a locked unit. Postpartum is separate from labor and delivery. So I'm in postpartum. And I will watch these mamas in the charts, right? All morning, I'll be like, oh goodness, okay, they're 8 centimeters dilated, they're 10. Let's see how long, it takes them to push, and waiting for them to get over to postpartum, right? And sometimes they're in the labor and delivery suite for 4 or 5 hours after giving birth, and I'm just going bonkers. I'm like, no, I need to get to them within 6 hours. But because the way the hospital is set up, and because I don't have full access to labor delivery as well as postpartum, I'm not able to see, or my window, I can see them, but the window is very, very small. And it's usually right when I'm supposed to leave for the day. And I'm like everyone else. Like I have things I need to do at home. I have children, they're in sports, I got to get home. So there's been more than one time where I'm like, okay, I can see in this chart that this mama had some complications. I can see the labor was long. I can see she's a first time mom. I can see the baby went to the NICU. Any of those things are kind of red flags that there is a chance for having had a traumatic birth experience. And so I'm like, okay, I feel like these mamas need me. And so I stay a little bit later to help those moms. And I love to do that. But again, I'm one person. And if this were to be sustainable, beyond just me trying to build a program, it would need more than one therapist, and the schedule would be needs to be a little bit different. So 7 to, yeah, I would say on average 4:30, 4:45, 5 even. And then I work Monday through Thursday here at the hospital. And then Fridays are my days to get everything organized for my program and for contacting the school, talking to my advisor, etc. So that's what it looks like for me. And I do have a lot of moms, like I said, trickling in right when I'm supposed to leave. So that's a little frustrating. But 7 in the morning, what do I do when I get here at 7 in the morning? The first thing I do before anything else, before I get my coffee, before I get my water, all of those things, the very first thing that I do is I check the charts. And I wish that there was a better system. I wish there was a better charting system to find moms, like put them in order of who has had babies most recently, because as of right now, that's not available. I just really have to manually go in and click on things. I can look. I have a page set up that I customize to where I can see how long those moms have been in the hospital, which gives you some idea. But sometimes you have moms that are in labor and in the hospital for like 2.5 days. And sometimes you have moms that are in the hospital for like zero point 0.2 hours or whatever. And, the one that was here for zero point 0.2 hours could have had a baby right, most recently, but then it could also be the mom that was here for like 36 hours that had the baby most recently, and you don't know. So you kind of just have to click around, and it takes a while. And then, I do chart reviews on those moms. So the moms, if there are any moms that have had babies within 6 hours, I prioritize them. I do their chart review right away. I fill out the necessary paperwork because I am keeping track of data to see how my program progresses, and room for improvement. So there's a little bit more chart review that I do than would probably be done typically, on a OT floor or, in any kind of setting, especially inpatient. Um, so do my chart review for those mamas. I get to them right away. I go to their room and, I talk to them, assess them, and then provide interventions as needed. So once that's done, once I've seen those moms within the 6 hours, I go and I check to see labor and delivery if I have anyone who has given birth in labor and delivery that is likely to come over to the postpartum section of the floor. And if they're close, then I will usually do a chart review for them and put in their information into my system that I'm using to track all the data. So once I do that, I will then go and get my coffee and my drink and get settled, check my emails, do the basic things that everyone does when they get to work. And after that, if I am doing like a half day of building my program, like the website and content, I will typically do that in the morning based on where the moms are. Because, like I've said, I have found that most moms give birth in those evening hours. So if I don't get to them first thing in the morning, if I can't get to them within those 6 hours, I'm not going to be able to catch them in 6 hours. And that's what I really prioritize right now. So I will build my content usually in the morning, and then 11, 12, right around when a lot of people go to lunch, I will switch over and check on those mamas that are in labor and delivery and check to see if anyone came over to postpartum. And the hospital I'm in is, I love that they do this, but they have this button, they have moms push when they go from labor and delivery over to postpartum. And when they push the button, then over the speakers, it plays a lullaby, about maybe 5 to 10 seconds of a lullaby. And they can hear that, in the hallways throughout the hospital. And it's wonderful. I think, especially in the era of COVID and things are pretty grim, it's something to be joyful about and celebrate. You get to know, everyone gets to know in the hospital there's a little baby born. And it, to me, it brings me a lot of joy. And also, it's very useful because that's my cue that those mamas I've been tracking in labor and delivery, one of them has come over to postpartum. So then at that point, I'll usually get my ducks in a row, make sure I have everything filled out for them, look and see if the chart has been updated since I last looked. Then I will go see them and assess them. And I usually do that until lunchtime. And then I go to my lunch, usually about 2 o'clock. And then at that point, after lunch, and that's when I conference with my advisor, or excuse me, my mentor here at the hospital. She's a NICU OT, and we chat and kind of touch base there during our lunch together. Then after lunch, I'll go back, and I usually have mamas having more babies then, like the moms that had babies in the morning, early morning or late morning, and moms that have babies in the early afternoon will start trickling in about 2:30, 3. And so I try to see as many as I can at that point. Um, And at that point, I will do the chart reviews, go and see them. And if I see mom is coming in, especially if they've had traumatic births, I try to see them before I have to leave for the day. So that's what it looks like when I do kind of more of that half day. But when I do the whole day of seeing moms, same thing with the morning, same thing with prioritizing women within 6 hours. In the morning, once I have seen all of those mamas within 6 hours, and I've done chart review for labor and delivery, mamas that have given birth and are just waiting to come over to postpartum, then I will go see those other mamas that I haven't seen yet that had babies over the night and I can't see within 6 hours. And I do, again, ethically, I feel like I need to provide them with services. I am collecting data from them to kind of compare between them and moms that did get interventions. And to me, they need some services. So I will go through the questions, the universal traumatic birth questionnaire that I have that's research based. The original form has been validated and shown reliable. I have updated it, the language in it, because I found most moms did not understand. It was too high level for a lot of moms, especially after just giving birth, and they're a little bit not as oriented to everything the wider world as they typically are. So they're a little bit wonky, they're a little bit tired, they have medications in their system. So the questionnaire for me, I found not to be successful as written. So I did change some wording, minimal though. In any case, I ask mamas those questionnaires, and based off of their answers, I either provide them like mental health services, um, ways to prevent postpartum PTSD if it's within those 6 hours. Again, I do the visuospatial cognitive intervention, which is like Tetris or Candy Crush. And then if it is something that like it's been more than 6 hours, then I usually provide them with those services I talked about, talking about yoga, meditation, breathing exercises. Some other things I always ask is if they had lower back pain during their pregnancy, and I go over my ergonomics training that I have a video on with them, just really brief, giving them the basics, and I give them the opportunity to ask if they have questions or they need more information. And then I do the same with safe infant handling. Usually, if they've had more than one child, I'll ask them if it's been a long time, if they feel comfortable and confident in handling their child. And sometimes when it's been a long time, moms want that help again. They want someone to go through it with them again. And first time moms always want that information. But even with moms of two or more kiddos, I will usually go over just basic information like how to prevent the baby from getting an upset tummy and spitting up more than normal, things like that. And from there, I also ask questions, and um, I give them the opportunity to ask any kind of questions as far as feeding. And I am not a lactation specialist, and I let them know that. And I say, I can give you general information about feeding and routines, but if you have in depth questions, let's get the lactation specialist in here. And a lot of times, those questions are from my mamas who have NICU babies and they are pumping. And so questions like, okay, the lactation specialist said to pump every 3 hours, but no milk is coming out. Do I still pump every 3 hours, or do I just keep pumping until milk comes out? And I'll tell them things like, just stay on that 3 hour schedule, pump for the amount of time she told you to. And really, what it is it's trying to stimulate that milk production. And it can take a little bit longer for moms that had preterm infants, I have found. And I say, just trust it, it will come. Relaxed, don't stress about it. Do something calming while you're pumping, and it will come. And if you have in-depth questions, let's get that lactation specialist in here. So just I try to be as helpful as possible. I ask them if there's anything that they need. If I can go grab them something from the nourishment room or a warm blanket. And I do then also with all my mamas have them fill out a baseline assessment of the HADS, the Hospital Anxiety and Depression Scale, and then the ASDS. And I use that information with their contact info as a baseline assessment. And then a month or two later, I then contact them and have them do the same assessment. And the reason why I do that is I'm looking to see if there's a change. And I let moms know this. Is there a change? Are you looking like maybe you're going more in the route of depression, anxiety, PTSD, all of these things? And once I explain that to moms, they're usually very receptive. They want to fill it out. They give me all their contact info. And it's something that I kind of worried about working with moms who just had babies. I'm like, are they going to want to work with me? But when I explain to them how important it is, mental health, I talk to them about how postpartum PTSD can then morph into postpartum depression, postpartum anxiety, and how they're related. And moms don't want that. And I explain the importance of attachment to baby and mom's mental health matters, self care and occupational balance for mom matters when they're going home, and that baby is not going to have great attachment if mama doesn't have amazing mental health, okay mental health. And so I say, when you're taking care of mama, you're taking care of baby. So give yourself that occupational balance, and don't spend all of your time making sure the house is perfectly clean or the meals are cooked right on time or your baby is perfectly, like, never cries, and other children are always perfectly happy. It's a, all those things matter, but they need to be balanced with your self-care, whether it be like showering, toileting when you need to, and having those sexual experiences once you've been cleared to, and that's important for mental health and bonding with your partner as well. And that's how this whole thing started, right? That's how babies came about. And so you don't want to just have babies and then have it go away. We're all sexual beings. And so we talk about that. And we talk about, you want to balance that also with things like socializing and play. And I think a lot of the way that new moms play is once they're cleared to then have sexual experiences to engage in that play there, and that creativity, and that fulfillment and joy. And talk about spirituality, that it's important mamas feel connected. They feel connected to a higher power, whatever that is for them. It doesn't mean that you have to believe in God. It doesn't mean you have to belong to a specific religion. It just means feeling connected, feeling connected to the world, the environment, um, their family members, the community, all of those things. And we talk about how important it is to also have those leisure activities. For me, my leisure activities are also kind of some things from health management. I love to go for walks. I love the outdoors, especially when it's good weather and it's not 120 degrees here, right? Like, I like to go for walks when it's hot, really hot out. I like to swim. I just really like to be outdoors, and that's great for my health management, but it's also my leisure activity. And then there's the health management. Are you making sure you're going to your appointments? Are you making sure you are paying attention to your body? So are you eating enough? Are you making sure you're getting that physical activity? If you are getting wrist pain, thumb pain, lower back pain, are you getting into your doctor and getting a referral to the physical therapist or the occupational therapist? Are you putting braces on to protect your wrist if you start to get pain? So things like that. And I just talk about how a lot of first time moms, myself included, guilty as charged, right? And we feel like we have to keep up. We have to earn our keep, especially if you're a mom really a mom who's been a stay at home mom or a working mom. You feel like, okay, I am home now. I don't feel like I'm at work, slaying dragons at work, and so I have to be super mom. Doesn't matter if I need to recover or not. I have to have everything be perfect, for everyone else. And the point of this is, you need to be balanced. Mama needs to be balanced for everything else to work. If the house is, not perfectly like model home clean, that's okay. It's okay to have some dishes in the sink. If we don't have like garbage on the floor or feces on the floor or cockroaches and rats all over, like, you're okay. It's okay. That's a lived in home, and that is fine. It's okay to, accept meals from other people and let or friends, or even to, go out to eat, or get frozen meals, or ask your spouse to cook. That is okay. In fact, you need that. You need that because your body is trying to recover and you're trying to take care of baby. So that is the story that I go over with moms, especially first time moms. A lot of moms that have had multiple children, and they will tell me that, yes, the first child, they did that, but they didn't get that balance. So it's really common. and it's something that can really impact you personally, which I'm really focused on, but also your infant and your family and your relationship, which then in turn is a cycle. So we just want to prevent that cycle from occurring. Um, so that's what I do. Usually about 10 hours a day. I think 12 hours works best, but because I work 4 days a week, and those 3 12s aren't really possible for me right now. But if I were to build a program, I would probably do 3 12s more similar to nursing staff. And then I would have some overlap. And I know that therapists don't traditionally work in, shift work at all. But I do think there could be a benefit of like an early swing shift. So have some mamas come in at like 6, 7 in the morning, and then have some mamas come in like maybe 11 in the morning, noon, something like that. And so there's a little bit more overlap to catch those moms within 6 hours. So again, like if somebody leaves at midnight and someone gets there at like 6 in the morning, you have a better chance of catching those moms in order to provide those interventions. And the chart reviews that I do are, again, more in depth than probably typical than what I've done in like subacute or in a mobile outpatient. And these chart reviews are really, I'm looking at everything. I'm reading the operative notes within the labor and delivery suite or the OR when a C-section occurred. I'm reading their history. I'm reading the baby's history as far as do they have any complications, etc. I'm going through everything. I'm going through contact info, demographics, all of that. So I think that's helpful for me to see the whole picture, but it's also not necessary for if you're not trying to research or keep tabs on everything, if you're really just trying to help moms like a normal therapist, OT would do. So those are my recommendations. That's how I operate. I feel like I have great success. I'm not able to do the typical thing that I've done, like in subacute. When you come in, you do your chart reviews first thing in the morning for all your patients. And for the patients you've had for a couple of weeks, you look at the most recent notes from nursing staff. I don't, or other like PT. I can't do that here. I tried to do that at first, just do all of the chart reviews first thing in the morning. But then I was going bonkers because I would have some mamas leave as soon as I did their chart review. And so I wasted all this time and I couldn't, work with them. And then I would have other mamas that I could have seen within those 6 hours, but I wasted my time doing chart reviews for women who left already. Um, so really what it is just prioritizing. Okay, who's had babies within 6 hours? Let me see them. And then after that, see the other moms. And you kind of have to do chart reviews throughout the day. And that's what works. Um, so I hope that this was illuminating and you got a good idea of what my day looks like working in maternity units. Again, thank you for joining me. Bye.